Caregiver who stole morphine from nursing home is sentenced to probation. Operator accused of leaving a wide path of destruction shuttering two facilities. Staffing emphasized more in new nursing home rankings from U.S. News and World Report. And Senate committee releases unfavorable report on nursing home emergency preparedness. This and more next.
You're watching LTC News with Dane Henning.
Welcome to CNA TV Long-Term Care News. I'm Dane Henning. Today is Wednesday, November 7th, 2018. A woman who stole morphine from a Blair, Nebraska nursing home was sentenced to probation last Tuesday in Washington County District Court. Abby Arnold, 35, pleaded guilty on August 28th to theft of a controlled substance, a Class 4 felony. Judge John Sampson sentenced Arnold to 2 years probation. Prior to sentencing, Arnold accepted responsibility for her actions. Arnold was arrested September 15, 2017 on a warrant after a Good Shepherd Lutheran Community employee reported to Blair police that a bottle of morphine was missing from a medical cart at the nursing home. Arnold said she has been in treatment and sober for 120 days. She is motivated to turn her life around to continue a relationship with her 6-month-old son. A troubled skilled nursing operator is shuttering 2 of its facilities in Massachusetts as pressure continues to mount from its creditors and Bay State regulators. Synergy Health Centers said it will close its communities in Sunderland and Waban. The company has been saddled with debt with more than $31 million in unpaid mortgage loans and other bills. 8 of its facilities are now in the hands of court-appointed receiver. The provider has been hit with an array of fines for medication errors, inadequate staff training, lax infection control, and improper treatment of pressure ulcers, the Globe noted. Several of Synergy's homes are slated for sale pending an approval from the Department of Public Health and a judge. That would leave the New Jersey company with just a single remaining skilled nursing facility in its control for the moment. Synergy also came into the crosshairs of state investigators in September after it let insurance lapse for its employees. We'll be back right after this break.
Watch Grassroots Advocacy with Jeff Wellman. Thursdays at 2:30 Central on CNA TV.
U.S. News and World Report unveiled its rankings of the nation's best nursing homes, with 2,975 earning top honors. The organization said it modified its methodologies of evaluating the country's 15,000 nursing homes to place more of an emphasis on staffing quality. It also added a new short-stay rehabilitation rating, aiming to provide potential patients with a clearer picture of the quality of care provided to individuals after a surgery, stroke, accident, or illness. Since the ranking started in 2009, U.S. News had relied on data from Nursing Home Compare to compile its list. But with the Centers for Medicare and Medicaid Services moving to a payroll-based nurse staffing reporting and a freeze in health inspection data since November 2017, the organization said it has modified the way it uses CMS data for evaluating facilities. It used staffing data only from April 2018 onward, when CMS began using payroll-based records. Wisconsin was the state with the highest number of, quote, best nursing homes, totaling 176, that received either an overall or short-stay rehab, quote, high-performing rating. Hawaii, Maine, Rhode Island, and Wyoming, meanwhile, have the highest proportion of best nursing homes. Members of a prominent Senate committee on Friday released a scathing report on emergency preparedness in the nation's nursing homes, accusing both operators and federal government of failing residents during storms and other disasters. Compiled by the Democratic members of the Senate Committee on Finance, the report, titled Sheltering in Danger, specifically looked at operators' responses to Hurricanes Harvey and Irma in 2017. The latter storm claimed a dozen victims at a nursing home in Hollywood Hills, Florida, after a power outage sent inside temperatures soaring. The investigation identified gaps in nursing home emergency preparedness and response, particularly when their vulnerable residents are sheltered in place. The New York Times first reported on the results of the senator's investigations with Democratic Senator Ron Wyden of Oregon telling the paper that, quote, too many operators are not equipped to handle matters of basic safety in disasters. This has been your long-term care news update. Everyone have a wonderful week, and I'll see you on Wednesday.